Good evening, community. Derek back with you from Optimize U Evansville, here to talk about our advanced cardiac panel. February is Heart Month. Jessica and I hit on the numerous labs that we offer at Optimize U that can help us better evaluate our heart and health status. It's not just typical cholesterol anymore. It's not just what your HDL and your LDL is. There's a whole lot more labs out there that we can really get into the in-depth analysis of how well your cardiovascular health is. Some of them you're going to be heard of before. Some of them you may have routinely ran on you. But I want to be able to relate that back and why it is so important for us to do things like control our blood sugar and what that means for our heart health. Controlling our whole body inflammation and what that means for our heart health. So let's get into it. Jessica and I named off several of the labs that we offer and that are part of that cardiac panel. One in particular is getting more and more press. You'll hear about it if you're listening to podcasts and those things, and that's a CRP, or a C-reactive protein. C-reactive protein is a highly sensitive marker for systemic inflammation. And if systemic inflammation is going on and running rampant in your body, it puts you at higher risk of development of atherosclerosis, or hardening of the arteries, and cardiovascular disease. So what I always try to explain to people is that if your body is constantly inflamed, just think of everything as just kind of fluffy and wants to grab onto a lot of things. So everything that's passing by the inside part of your arteries in your bloodstream is going to grab that on, and then that we can have a plaque development then, and then we get that narrowing of the arteries, and then bad things can happen. So we want to make sure that C-reactive protein marker is way down. That's part of the cardiac panel that we have. There's a couple of different conditions that you can have that cause a elevated CRP chronically. Those have to be treated as well. A lot of autoimmune disorders, you'll have a high C-reactive protein. Infection, really bad infection called sepsis, you'll have a high C-reactive protein is one of those markers that is evaluated for that. But anyway, C-reactive protein is a very, very commonly elevated marker for people that have cardiovascular disease. It's not necessarily specific for cardiovascular disease, but it is one of those things that we monitor for. The second lab that we talked about, and maybe not so familiar, but you may have heard of it before, is homocysteine. And homocysteine is an amino acid that, when elevated, it can damage blood vessels and contribute to atherosclerosis and thrombosis, which is a big term for clot formation. So high homocysteine levels have been linked to an increased risk of heart disease, stroke, for those particular reasons, but also dementia. So if you have a chronic narrowing of the arterioles and the blood flow is diminished to, say, certain places in the brain, where it may not be of clinical threshold where you're having like a stroke, but just that chronic low-grade diminished blood flow can lead to dementia. And so we want to make sure that those homocysteine levels are in check, make sure that we're treating them properly. Homocysteine levels are greatly influenced by B vitamins, so like B6, B12, and folate, making it a definitive modifiable risk factor. And we can certainly take care of that through a lot of different, not just medications. So C-reactive protein homocysteines are not the most common labs that you'll see, but when we're talking about cardiovascular health, definitely important. So the next thing we get into is this NMR lipid panel. And NMR stands for nuclear magnetic resonance, and people automatically think of an MRI when they start hearing those things. But what that does is it gives us an incredibly detailed breakdown of lipid particles. So most of the time you go to your doctor and you're getting your cholesterol checked, where you have to be fasting, you have to show up early in the morning, and they'll look at your total cholesterol, your HDL, and your LDL. HDL is high density lipoproteins, LDL is low density lipid proteins, and your triglyceride levels will be assessed in that as well. A lot of times they'll look at and see, well, your cholesterol is less than 200, your HDL is 39, your LDL is, you know, 130, you know, and they'll put you on statins, but or whatever, but they'll say that your total cholesterol is actually pretty decent. Well, those people have heart attacks too, you know, and those people have atherosclerosis as well when you look at things like a calcium score, or when you do coronary CTAs where they put you in like a CAT scan machine and they're able to look inside the artery with some dye. So why is that? And a lot of times what they have found is that, yeah, you know, these numbers are good, but there's a whole lot more to those numbers. And if that's a recurring theme with everything we do at Optimize U, so it's the whole normal is not optimal kind of thing, right? So this is just another example of that. So the LDL particle count, or LDLP, if it's a higher number of small dense LDL particles are associated with a greater risk of cardiovascular disease, even if total cholesterol appears normal. So it's back to one of those things where this is almost kind of an inverse kind of thing. So even if you have a normal total cholesterol, we really want to know what those LDL particles look like, and treat those, again, even if you have a normal cholesterol. HDL and triglyceride subfractions, are also assessed in that. They'll help us assess lipid metabolism and insulin resistance. And then a lipoprotein insulin resistance score, or LP-IR, also gives us that evaluation of the metabolic syndrome, which is the hypertension, the obesity, the insulin resistance, and also future risk for diabetes. So we can actually, the person that kind of looks the part of a diabetic but may not be quite there yet, we can assess this LPIR and say, hey, you know, we're cruising down the wrong path here. We need to start treating this early before the disease process ever develops. If we get a little bit too far in that another way that we can assess things like metabolic syndrome and diabetes or diabetes risk is what's called a hemoglobin A1C. And this is a pretty common one. Most people probably have had this ran on them if they've ever been called like a pre-diabetic before, or what, you know, during your normal routine lab. So what a hemoglobin A1C measures the average blood glucose over the last 2 or 3 months. So it gives us a really better picture of what is going on, as opposed to, hey, you get some fasted labs in the morning and, you know, maybe people, hey, I've been eating pretty bad here recently, I'm going to quit eating like at 5 and really get everything kind of down in for my fasted labs. Hemoglobin A1C will let us know if you're kind of cheating on those fasted labs. So an elevated hemoglobin A1C is a marker of insulin resistance and diabetes, both of which contributes to endothelial dysfunction and cardiovascular disease. So endothelial dysfunction is a common word that you're going to hear here. Endothelium means the inside part of the artery. So the inside part of the artery should be very smooth. It should be compliant. It shouldn't be stiff. It should be very kind of flexible, and not with any scarring on the inside of it, to where things like blood and platelets and cholesterols and all those things want to end up getting sticky to. So we want that to be nice and smooth on the inside with no damage. We want the vessel to contract, to constrict, or contract and expand as much as we need it to, based on our body's demand. So we want that endothelial function to be as optimal as possible. Hemoglobin A1C also helps us assess metabolic health, again, which is strongly related to heart disease. The next one is kind of something, I mean, people obviously have heard about iron deficiency anemia, and I need to check my iron because I'm tired and all these kinds of things. But iron as a lab associated with cardiovascular health is pretty foreign to most people. So iron levels are important for oxygen delivery to the tissues via hemoglobin. So hemoglobin is a normal lab. We check it on everybody. Every time you get lab work with us, you're going to get a hemoglobin checked. And hemoglobin is the molecule on the red blood cell that transports oxygen. So both iron deficiency and iron overload can impact cardiovascular health. So iron deficiency can lead to anemia, which increases cardiac stress. You know, obviously, if you're anemic and you have a low hemoglobin, well, then your body doesn't have as much capacity to transport oxygen. If oxygen isn't carried to the muscle, well, then we have bad issues that go along. But an excess of iron can be seen in conditions like hemochromatosis, that it can contribute to oxidative stress and arterial damage. So again, here's that term that we these recurring themes: oxidative stress and arterial damage. Arterial damage meaning that endothelial dysfunction that we talked about with the hemoglobin A1C. So excessive iron, if you can imagine if you can imagine like animated in your brain, you have this tube that you want to be nice and smooth that your blood is running through. If that blood is real thick with something, whether it be a lot of fat or whether it be a lot of iron, then it's not moving as efficiently as it should. So iron is something that we don't think a whole lot of when we think of cardiovascular health, but it's definitely important. Another evaluation of iron storage and inflammation is a ferritin level. Ferritin is a marker for iron storage, but it also behaves as an acute phase reactant, meaning it can be elevated when our body is inflamed. So a high ferritin level can be linked to increased risk of heart disease, metabolic syndrome, and oxidative stress. A low ferritin level can indicate iron deficiency anemia, which again can lead to that fatigue, cardiovascular strain that we just talked about. So why is all of that important? It's just because cardiovascular disease is multifactorial. So I have a distant history of I worked cardiology. That was my first job out of school. I learned from a wonderful, very forward-thinking cardiologist, and we checked all these things. And that was, I hate to admit, 20 years ago at this point. Okay, so we checked a lot of the LP little A's, and we ran into the same problems that we run into now. Is that insurance won't cover a lot of these things. Why would you check, someone's LDL particle size when they have a normal cholesterol? And again, it's these same arguments that we have on why we exist. Were going on 20 years ago. So it is important to have all these things checked. We're going to get into some other things here real quick, but just as a broad surface, when you're getting your cholesterol checked, make sure that, or at least request to check all these labs. And if you run into some issues, we got you covered. Okay. So there's some lipid kind of protein markers that show up whenever we talk about the panels that we offer. One is lipoprotein A, or LP(a). That's a genetic marker for cardiovascular risk. High levels of that, you have increased risk of atherosclerosis and thrombosis, even when you have a normal cholesterol level. So again, normal is not optimal. So if you think of, when we talk about testosterone, we want to treat those normal because you're not feeling better. These can be quite the other, right? So you could have a normal cholesterol but still have some things brewing that you would want to know about, and these are readily available to you with us. Another one is apolipoprotein B, or what we call ApoB, which directly measures the number of atherogenic, meaning that the plaque forming, atherosclerosis means plaque forming, lipoprotein particles, LDL, VLDL, and LP(a). So it's a more accurate predictor of cardiovascular disease than even LDL-C alone. So LDL is what you get when you get your normal kind of markers. If LDL is really high, we know that there's an increased risk of cardiovascular disease. But this is even better than that. And that's what I tell people when we're doing that initial, when I do a lot of initial consults, I tell people that total cholesterol, or those cholesterol panels that you get as far as your routine screening, aren't, they give us just a kind of a 50,000 foot view of just overall health, It's not, there's nothing that there that says you're going to have a heart attack or not going to have a heart attack. There's no way to prove it, but it really gives us more of an indication on just overall lifestyle. If your triglycerides are through the roof, you can have genetic issues, you can smoke, you can have a real crappy diet, or 1,000 other things, but it gives us a little bit of an indication of how you're living. And really that's about it. we really have to break down to these other markers in order to know what is what you're really at risk for. So apolipoprotein A is the main protein in HDL cholesterol. It reflects the body's ability to remove excess cholesterol. So HDL is the cholesterol that pushes all the bad cholesterol out of the way. That's why we want those high HDL ones. And high levels of that are associated with better cardiovascular protection. There's also a triglyceride HDL ratio, which is a key marker for insulin resistance and metabolic health. A high ratio, greater than 3, suggests increased cardiovascular risk. So again, when we keep going down through a lot of these, labs, it is all about, cutting down inflammation, increasing endothelial dysfunction. Some of that is genetic, some of it's not. Some of it's modified by lifestyle, some of it can't be. Some of it requires some medication. Some of it we just have to know that it's there. So a lot of these having to do with cholesterol, lipids, all of these things are most of the time modifiable by the lifestyle choices that we make. Some other labs that we check: insulin and fasting insulin levels. This helps us identify insulin resistance and early metabolic dysfunction, even before a hemoglobin A1C or a glucose level rises. So chronically elevated insulin can contribute to vascular damage and atherosclerosis. That's what we call this, you're developing this insulin resistance. So if your insulin is constantly staying high, that means your body is constantly kind of cranking out insulin for whatever reason. And eventually, your body quits doing that. Type 1 diabetics generally don't have any insulin, and they don't have the ability for the pancreas to secrete insulin. That's why they have to take insulin. Type 2 diabetics have typically had some sort of issue that has caused their body to have increased insulin resistance. Therefore, their body can't control its blood sugar into an optimal range anymore. So we have to treat that with medications. Sometimes those people have to go on insulin as well as a supplement to their by mouth medications. There's all kinds of other labs too that we get into in a more acute phase of cardiac stress, but we won't be doing those in the clinic. Those are more of an emergent kind of lab that we look at and on an emergency room basis. So when I worked cardiology, I also worked in the emergency room. People would come in with chest pain. We expect them to have having some heart issues or cardiac related chest pain. There's a lot of really acute markers that you can do, creatine kinase and myocardial bands and troponin, that will let us know if there's something really bad going on right now. So I know that's a ton of information to ingest, and then it's kind of like, okay, what do we do about all this stuff? How do we treat it? So if we have a high level of lipoprotein A, we can do niacin, we can do regular exercise, we can do LDL lowering strategies. A lot of that is lifestyle changing. But again, those are modifiable. If they're low, we don't care. Great. There's no reason to be concerned if you have a low level of lipoprotein A. ApoB, a lot of times those are treated with statin drugs. Zetia is a good selection for if you're opposed to taking statins. Lifestyle modification is key, like a Mediterranean or keto style diet, and reduce those processed carbs. A way to treat low levels of that, you can increase your healthy fats, olive oil, omega-3s, and resistance training. So again, we want an optimal range of those things. The triglyceride HDL ratio, you want to lower your carbs and your sugar. You want to increase your omega-3s like fish oil, exercise, maybe consider some fibrates if it gets really severe. We also, if it's a low level of that, then we really need to address any kind of underlying malnutrition or metabolic issues. C-reactive protein, if that's too high, those are anti-inflammatory diets like omega-3s, turmerics, fibers. We want to address any infections or gut health that maybe is going on. And, sometimes a low-dose aspirin would be indicated for that as well. Low levels we're not going to worry about. Homocysteine levels that get too high, we want to talk about B vitamins that gives us B6, B12, and reduce the oxidative stress sources. Insulin and fasting insulin treatment for high levels. We want to exercise. Sometimes metformin is needed for that. We can get into metformin is one of those drugs that really has untapped potential. I can remember hearing about metformin probably 15 years ago as a longevity, kind of how to age well medication. So when people think of metformin, it is just for your type 2 diabetes, but there's a lot of other added benefits to that as well. Maybe we'll touch on that sometime. Treatment for low levels for low levels of insulin and fasting insulin. People that have hypoglycemic episodes or some, you want to consider maybe some sort of adrenal dysfunction, and we can do that again at Optimize U. Also, optimizing your carbohydrate intake if you're underweight. In a nutshell, in order to help your cardiovascular health, number one is nutrition, number two is physical activity and exercise, and number three, if none of those are helping, then we start talking about supplements, and if that doesn't work, then we start talking about medications, right? So nutrition-wise, anti-inflammatory foods such as turmeric, ginger, green tea, dark leafy green vegetables, Mediterranean diet that's high in olive oil, nuts, avocados, lean proteins, and fibers. Reduce your sugars and processed carbs. Think of things for exercise and physical activity like strength training. We are so avoidant of strength training. We're all just cardio nuts. We think that if we just go run constantly, it's going to help. No, you have to put on some muscle in order to help these things out. You can do cardio in a zone 2 training. We'll get on that at some point, but zone 2 is based off of your heart rate. It's individualized for each person. But what that also does is improves mitochondrial function and heart health. Supplements for heart health, omega-3s, CoQ10, magnesium, vitamin D, NAC, glutathione. We have all of those things readily available to you to Optimize U. And last, and hopefully never gets to this point, we have to sometimes treat these things with medications, and we don't like to do that. We would love for the lifestyle modifications to really be able to handle a lot of those things, but for some folks it doesn't. So we always have to we always want to put you first, make sure that your health is optimized, and then when sometimes we require some medications to do that. So, in conclusion, it's a lot of information to take down. I appreciate you guys. Cardiovascular health is incredibly multifactorial. It requires an integrative approach. Standard cholesterol tests completely miss the boat on inflammatory and metabolic risks that are associated with that. And personalized intervention based on these biomarkers can prevent disease before it manifests clinically. Lifestyle over medication, always, whenever possible, but pharmacological intervention is sometimes necessary. So that is a lot to digest, but it's a lot of labs too, and it's a lot of it's just one more aspect at Optimize U that we can offer you. Everybody take care of their heart. Everybody, watch your diet, get some exercise, get out and get moving. We had an unexpected snow today, so go find a gym to go get on a treadmill for. But do something for yourself. This is Heart Month. Do something for your family. They want to keep you around, and I'm sure you do as well. So, that being said, stop by at Optimize U. Get your heart panel scheduled up. You do have to be fasting for it, and we'd be glad to go over those results for you. Please like and subscribe to our YouTube channel, and I hope everybody has a wonderful and safe week. Thank you.